President Donald Trump decided to recently weigh in on a protest that took place in the United Kingdom with regard to their national health system. Now, what Trump tried to do was imply that citizens of the United Kingdom are not satisfied with their universal healthcare system. And unfortunately for him, he quickly got put in his place by Brits and ended up looking like a jackass. But before we get to his tweet, I actually want to give you the context first as to what's actually going on with respect to the UK's national health system, because when you understand what's happening, then it really makes Donald Trump's tweet look that much more preposterous. So according to Lynn Jenkins of The Guardian, thousands of people joined a demonstration in London ending at Downing Street on Saturday in protest at what they say is the crisis facing the national health system. Bearing placards with slogans including "More staff, more beds, more funds," and "Saving lives costs money, saving money costs lives," they chanted, "Keep your hands off our national health system," as they set off from Warren Street at lunchtime. The demonstration, called NHS in Crisis, Fix It Now, was organized by the People's Assembly and Health Campaigns together. Clearly, they are telling the Conservative government, currently in control of Parliament right now in the UK, that they need to adequately fund their national health system, because they're not doing that right now. And besides defunding Britain's national health system, Health Secretary Jeremy Hunt is proposing radical changes that has led to him actually being sued, because British citizens are worried that what he's doing now could facilitate partial privatization or maybe even full privatization of portions of Great Britain's healthcare system later on down the line. And they don't want that to happen. They like their national healthcare system, and they don't want portions of it to be privatized. They don't want a system that looks more like America's system, because they know our system is broken and they know that their system works. They're just simply demanding that the Tories actually stop trying to sabotage it and adequately fund it. Now, this is what Jeremy Hunt is doing specifically. So according to BBC, NHS England wants hospitals and other trusts to work closely with general practitioners and social care services to look after more patients in their communities rather than in hospitals. In some areas, these groups are developing into accountable care organizations, or ACOs, which will hold contracts to provide services. Critics argue that this could pave the way for privatization of parts of the NHS, and that Parliament has not legislated to allow the process to even happen. And Sarah Bosley of The Guardian explains a little bit more as to what's specifically driving dissatisfaction. A small additional survey by the British Medical Association of 422 doctors shows 71% believe accessing care has become more difficult for patients over the last 12 months. Among hospital doctors, 65% have vacancies in their department, while 48% of general practitioners say there are unfilled posts at their practice. Now, a Labour MP named Dennis Skinner echoed the same concern as the doctors cited in that poll, and basically he's saying that he thinks the reason why the Health Secretary, Jeremy Hunt, and Conservatives are making these radical changes is because, well, they want to open the door to privatization.
In the course of this hour, there have been more questions about hospital closures than almost anything else, stretching from East Yorkshire, Berwick on his own side, Warwickshire on this side, Bolsover High Peak, Bolsover Hospital and Bakewell in Derbyshire. There's a growing suspicion that what this Secretary of State is up to is to leave them lose all those beds in the hospitals forever so that the private sector can move in and take the lot. That's what's going to happen.
So this tactic that we're seeing conservatives in Great Britain use is similar to one that Republicans use in the United States. So the way that they prove government-run programs don't work is by breaking them. They defund them, make sure that they can't do what they're intended to do, and they present all the problems with that particular government agency as evidence that big government is a boogeyman that we should all be worried about. In fact, Republicans complained that President Obama and Democrats weren't doing enough to take care of veterans, but when Bernie Sanders actually proposed a bill that would satisfy their demands, it would increase funding for veterans by $21 billion, give them access to healthcare and education. Guess what happened? Republicans blocked it. Literally every single Republican in the Senate, with the exception of two, Dean Heller and Jeremy Moran, voted down a bill that would actually increase medical funding to veterans. And this is what they had to say about it at the time.
I don't think our veterans want their programs to be enhanced if every penny of the money that's going to enhance those programs is added to the debt of the United States of America.
Greatly expand spending without any realistic offset.
I think the decision we've got here as we debate this legislation is whether we're going to commit to a promise that's bigger than what our kids can fulfill, that costs more than our kids can afford. My colleague pointed out most of the veterans organizations support this bill. He's in fact correct.
As far as the bill that the chairman has offered here, this bill's already been debated, and there are problems with this bill. It is an extensive piece of legislation. It has many good elements in it. It also has a cost issue at a time when our nation owes close to $18 trillion. And that was the reason why so many on my side of the aisle objected to it. And that's why I would object to the motion made here today by the senator from Vermont.
So when Republicans complained and complained and complained that President Obama and Democrats weren't doing enough to actually give veterans better health care, to better fund the VA, what did they do? They voted against it at the first opportunity they got. And the reason why they voted against it? Well, they said, veterans, they care more about the United States debt than their own healthcare. That's their excuse. Did they raise any objections over the cost of gigantic tax cuts to multinational corporations? They didn't. They just recently voted to give trillions of dollars in tax breaks to billionaires and multinational corporations, but back then, when a vote came up to increase funding for veterans' healthcare, they said no, it costs too much. And that's because they're not principled. They don't actually care about veterans, because if they voted to fully fund the VA, then they wouldn't be able to argue that government-run healthcare doesn't work. And this is what Dennis Skinner is kind of implying that the Conservative Party is doing in the United Kingdom. British conservatives are taking a page directly out of the Republican Party's playbook, so that way they can say, well, our national health system, it seems to be overburdened. Maybe we should outsource at least some of the services we provide to private companies. And then that once they outsource some of it, then it's going to be more, and they're just going to move closer and closer and closer to an American-based system where not every single person is covered. But British citizens are not stupid. They know exactly what conservatives are trying to do. They see how profitable the healthcare industry is in America. It shouldn't be an industry, by the way. And they're speaking out. They're taking to the streets, and they're demanding that conservatives keep their hands off of their national health system. They know that privatization is a slippery slope, hence why they took to the streets and demand that conservatives actually fully fund the national health system. So clearly, when you get the context, they don't want the government to touch it. They want it to just be fully funded because it works. It's worked for them for decades. So you know the story now. You know exactly what's happening. You know why they're taking to the streets. You know why they are dissatisfied with Britain's conservative government. But that didn't stop Donald Trump from commenting in the most idiotic way possible. So he tweeted out, "The Democrats are pushing for universal health care while thousands of people are marching in the UK because their universal system is going broke and not working. Democrats want to greatly raise taxes for really bad and non-personal medical care. No thanks." Okay, there are so many things wrong about that tweet. First of all, it's not going broke. It's getting defunded by a conservative government. The same thing that actually Donald Trump wants to do to our national healthcare systems like Medicare. Medicaid. After they passed their tax plan, knowing that that would add trillions of dollars to the debt, Paul Ryan immediately proposed cuts to Social Security, Medicare, Medicaid, because they created this problem, this debt crisis, and the way that they were fixing it is by defunding programs that Americans rely on. So to say that Britain's national health system is going broke is factually incorrect and downright idiotic, but let's also not forget that Donald Trump himself was arguing for a universal healthcare system of some sort all the way up until he was sworn in.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal healthcare.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
How?
I would make a deal with existing hospitals to take care of people. And you know what? This is probably...
Make a deal. Who pays for it?
The government's going to pay for it, but we're going to save so much money on the other side.
In fact, once he was elected, he actually demanded to know why Medicare couldn't be expanded to cover every single American. Throughout his career, he's always been in favor of a universal healthcare system of some sort because it works. It's common sense. Even an idiot like Trump can grasp how important a Medicare for all, single-payer, universal healthcare type system is. But I think the most frustrating part to me, and for Brits who saw his tweet, was that they were literally marching for the exact opposite reason he cited. But thankfully, I wasn't alone in being pissed off by this tweet because Brits actually defended their national health system. So Labour Party leader Jeremy Corbyn responded to Donald Trump and put him in his place, saying, wrong. People were marching because we love our national health system and hate what the Tories are doing to it. Healthcare is a human right.
Gotcha, bitch!
A spokesperson for British Prime Minister Theresa May states, the Prime Minister is proud of our national health system that is free at the point of delivery. So that right there is a really important comment. Even though what Theresa May and her government is doing is despicable, she's still saying here, our healthcare system is free at the point of delivery. It's universal, meaning people don't die if they can't prove that they have insurance. And do you want to know another person who condemned the idea that universal healthcare is bad? The individual who is currently trying to ruin Britain's national health system, Health Secretary Jeremy Hunt, who tweeted out, I may disagree with claims made on that march, but not one of them wants to live in a system where 28 million people have no cover. NHS may have challenges, but I'm proud to be from the country that invented universal coverage where all get care no matter the size of their bank balance. So, needless to say, this backfired tremendously. This blew up in Donald Trump's face because what he was probably hoping conservatives would do from the UK is they'd come to his defense and say, yeah, Donald Trump is right. We have a national health system that just doesn't work. But they didn't. They defended the idea of a national health system. Now, do I really believe them? No, because to say that you support Britain's national health system and you love being from a country that started a universal healthcare system, then you would not defund it. You wouldn't fuck with it like the way that Jeremy Hunt is. But he condemned this idea that a universal healthcare system is inherently bad, which is what Donald Trump wants us to think. So to make that tweet, not only is it incredibly ignorant, but it's even below Donald Trump because he knows the benefits of a single payer or universal healthcare system. He knows it. He's just a sellout who's now towing his party's line. And now, just for clarification's sake, a universal healthcare system like what Britain has is different from what we're pushing for. We're pushing for a Medicare for all system, a single-payer system like Canada's. But either way, all of these systems, no matter how you want to get to it, making sure that healthcare is free at the point of delivery is tremendously important, and that's what all of these systems would do. So Donald Trump thought that he could swoop in and reframe the situation, but unfortunately for him, it backfired and it made him look like an idiot.
Support this podcast by becoming a patron at patreon.com/Humanist Report.